All right, so welcome to our virtual town hall. We're so happy that you could join us during this very difficult and just surreal time. I hope that everyone is staying safe and healthy and sane, or as much as you can be during this time. It's not a typical town hall setting, but we wanted to make sure that we were able to stay connected to constituents across Shelby County during this safer at home order. We're going to give a brief update on COVID-19, what we know so far, and a couple of updates on what's going on with state departments. At the end, we'll be answering any questions. Can y'all hear me? That was interesting. Okay, so at the end, we're going to answer any questions that you all may have. If we cannot answer them, we promise we will connect you with a department commissioner or someone in government, whether it's local or state, that can. We're so happy that you all are with us, and I think that as this crisis continues, we will continue to make ourselves available through this platform, either as a group or individually. This virtual town hall is focused specifically on Shelby County. The Davidson County delegation, which consists of Senator Yarbrough and Gilmore, will do a presentation later on in the week. So first, I want to welcome Senator Sarah Kyle and Senator Katrina Robinson. We comprise the Shelby County Senate Democratic Caucus. All right, so do any of you guys want to give any remarks or anything before we get started?
What did you say, Senator Akbari? I'm sorry with my technical difficulties.
No problem. I said, would you like to give any remarks before we get started, Senator Kyle or Robinson?
I just agree with you, and I want to welcome everyone and appreciate your giving up your time in this difficult era that we're living in. I'm in Senate District 30. I represent North Memphis, Frazier, Raleigh, on out a little bit east, and I do include Overton Park. And I agree with Senator Akbari. We're going to try to get you information today, or we will get back with you should we not have it readily available.
All right, Senator Robinson.
And hello, everyone. It's Senator Katrina Robinson. I represent District 33, which includes Parkway Village, Hickory Hill, Southeast Memphis, Orange Mound, and a little bit of Collierville. I just want to thank everyone for taking time out of your afternoon quarantining and TikToking and cooking and eating to sit and talk to us about COVID-19. This is a very serious issue that is affecting our community across the country, and I don't think Memphis has seen the peak, so I'm glad that you all are here to get whatever information you all need to be prepared.
Thank you, Senator Robinson. We also, before we get started, want to give a special thank you to those that are continuing to keep our world going, from those who are driving trucks or who are stocking grocery shelves, who are clerks, who are working the front lines in our healthcare, from our doctors and nurses and everyone that keeps hospitals going. We're so thankful for them, for the work that they're doing, and for truly the sacrifice that they are making. We have not forgotten about these workers, and our caucus's mission is to fight aggressively as much as we can to make sure they are compensated, they are healthy, and they come out of this crisis. We want to thank the businesses that have stepped up and have risen to the occasion and have kept their employees on. We know so many small businesses that they themselves are struggling, but they are also making sure that their employees are getting paid. This town hall is about you guys. If you have any suggestions or information that you want to share with us, we welcome it. We are representatives of the people. That is our job, and that is one that we take very seriously. So we want to start this town hall by giving a brief background. What is COVID? What is the current data in Tennessee and Shelby County? What we can do to stay protected? What are some of our common symptoms? So I'm sure all of you all have been inundated with this, but we're going to go over it anyway, just to make sure everyone has all the information they need. So first, we're talking about what is COVID-19. COVID-19 is a new respiratory disease spreading around the world, and it is caused by coronavirus. So a lot of you all have heard novel coronavirus. That just means that it's a new. This virus is thought to spread mainly between people who are in close contact with one another. That's why they have the concept of social distancing, staying apart, because it can be transferred through respiratory droplets when an infected person coughs or sneezes. while it was initially believed that people were super contagious or they are super contagious when they actually are showing symptoms, there are people who are not showing symptoms. They're asymptomatic and they are still spreading the virus, which is why the guidance around wearing masks out in public has changed, so that if you are infected and don't know it, you will not continue to spread it. There's currently no vaccine or cure for COVID-19. Because it is a new virus, we do not have immunity to it like we do with the common flu, or we have a vaccine, or the common cold. So I think that's part of what makes this so challenging. The CDC has been providing a good amount of information and updates as it becomes available, but I think kind of that's where we are right now. Some of the symptoms, and I think we'll go into more detail about it later on, but it's on the left side of the screen. It is fever, cough, difficulty breathing, muscle pain, and tiredness. The key thing that we want people to keep in mind is, and I think some of the new numbers coming out around Memphis and in the state highlight that staying at home, social distancing will help stop the spread. And our projected numbers of needed hospital beds and those who will be infected and fatalities all depends on that. So now I'm going to kick it over to Senator Sarah Kyle, who will give us our current numbers in Tennessee and Shelby County.
Thank you, Senator Akbari. At the moment, Tennessee has over 4,000 cases. Of course, these numbers are due to change, but this is the best data we have today. We anticipate that these numbers will increase as we work our way up the curve, so it's extremely important that we follow those social distancing protocols so that we can work to flatten the curve. We'll go into testing locations and testing qualifications as we work through this presentation. Here, though, is a brief summary of the cases. As of this morning, the total number of cases is 3,633. The total number of hospitalizations, to the best of our knowledge, is 338. The total number of fatalities is 44. The total number recovered are over 290, and the total number tested are around 45,300. As far as Shelby County, our numbers are as follows. The total number of cases, 736. The total number of fatalities is 9, and the total number of negative tests is over 3,300. Excuse me. Remember how important it is to protect yourself and others. So what you see in the slides are recommendations from our Tennessee Department of Health and the CDC. Wash your hands often with soap and water or alcohol-based hand rub for at least 20 seconds, especially after coughing or sneezing. Do not touch your eyes, nose, or mouth with unwashed hands, and please stay at home if you're sick. Cover your coughs and sneezes with your arm or tissue. Clean and disinfect objects, our cell phones, computers, highly touched surface areas. In addition to the recommendations here, the CDC has recommended individuals wear cloth masks in public in order to prevent this community-based transmission. According to the CDC studies, a significant portion of individuals with coronavirus lack symptoms, asymptomatic, and that even who will eventually will develop symptoms and can transmit this virus to others before showing any symptoms. This means the virus spreads between people interacting in close proximity, speaking, coughing, sneezing, even if those people have not yet exhibited any symptoms. Now I'm going to kick it to Senator Katrina Robinson, who will tell us much more about these symptoms. Whoa.
Can y'all hear me?
Now I can.
Okay, great. So I'm going to go back to what I was saying for the last 2 minutes, but I wanted to reiterate what Senator Kyle was saying about being asymptomatic, not showing symptoms. That's why it's so important that we're staying at home, because those that look healthy to you, whether it's your cousin, your friend, or your mother, they may have already contracted coronavirus, but they may not be exhibiting symptoms, and then they can transmit it to you. And that further spreads the disease across the community. So the next 2 slides are going to show us some of the common symptoms of COVID-19. The Tennessee Department of Health reported illnesses have ranged from mild symptoms to severe illness and death for confirmed coronavirus disease in 2019. The following symptoms may appear 2 to 14 days after exposure. And this is based on previous MERS virus incubation periods, but you'll see fever, cough, shortness of breath, or even difficulty breathing. Some other symptoms can include tiredness, aches, runny nose, sore throat. Some people have even experienced a loss of smell or taste. That's in more advanced diseases. The severity of the COVID-19 symptoms can range from very mild to severe. So some people may have no symptoms at all. People who are older or who have existing chronic medical conditions such as heart disease, lung disease, or diabetes, or who have compromised immune systems may be at risk for serious illness. This is similar to what is seen in other respiratory illnesses like flu. And what we have seen is that one of the common threads in those that are severely ill is diabetes. And as we know, our southern states have high numbers, especially in Memphis. We have a high number of people with diabetes, hypertension, and chronic kidney disease. So that makes us more susceptible. But you should watch out for these common symptoms. That's going to be fever, cough, and shortness of breath. Not everyone with COVID-19 will have all these symptoms, but for many, it's going to be mild with no fever. It's important to know that you can still spread the disease even if you have no symptoms. So what should you do if you think you're sick? First thing you should do is call your doctor. You want to call ahead before visiting your healthcare provider, because most likely they're not going to want you to come into the lobby, especially without a mask. You want to follow that provider's instructions. They're probably going to send you to urgent care or the emergency room. You want to cover coughs and sneezes. Avoid sharing personal household items, and clean all high-touch surfaces every day. That's your doorknobs, your phones, your cell phone, your refrigerator handles, everything that you would touch in the day. You want to go ahead and wipe those down. And make sure you monitor those symptoms. But you need to know the emergency signs too. So people who exhibit the following symptoms should immediately contact their primary care provider. If you have shortness of breath or trouble breathing, persistent pain or pressure in your chest, new confusion or inability to arouse, bluish lips or face, you should go ahead and contact your healthcare provider. So if you do have those symptoms, we do have testing locations you can go to. If any of you are joining us from an outside county, know that you can find your testing location through this website if you want to take note of that. And it will be on our website so that you can get access to it. The locations will be added daily. Tennesseans should first call their usual source of care. If an assessment cannot be done in that location, individuals should call the assessment sites prior to going on site. Most locations do a phone assessment to determine if an in-person assessment or test is needed. Most individuals, particularly those with mild or no symptoms, do not need a test. If you do have mild symptoms, you should quarantine yourself for at least 14 days just to make sure that the disease doesn't evolve. I will say that it does evolve quickly. Day 5 is when you see most of the symptoms, but day 10 is when you're deep into the symptoms for coronavirus. So just make sure that you are aware of yourself. If you have children, monitor your children, your family members, and yourself. And if you notice any of those symptoms or any inkling, make sure that you go to your healthcare provider or go get tested. Now back to Senator Akbari.
Thank you, Senator Robinson, and particularly appreciate your expertise as a member of the healthcare community. So let's see if I can move this. Okay, our state and local agencies are working together to develop guidance and resources for Tennesseans to stay healthy and informed and make the right choices for their families. These agencies and their websites will continue to these agencies will continue to update their websites, of course. You can visit www.tn.gov. That's when we'll have information, usually where you can access every single department, whether the Department of Insurance and Commerce, the Department of Labor, the Department of Education, the Department of Health, the Department of Human Source, yes, or the Department of Human, I cannot think of that. Okay, DHS. All right, so I'm gonna go on to the next slide since I'm clearly struggling, and I promise it's just coffee in my cup. It's only coffee. Department of Human Services. I keep messing that up. All right, so a really important thing that people, parents, and children K through 12 are facing right now is not being able to actually go to school. A big part of concern was whether or not children would still be held responsible for these annual tests. They've been postponed for the 2019-2020 school year, which is really important because one, learning has been disrupted. There are several school systems across the state that are trying to do online testing, but it's not, it's not a standardized thing. I'm not online testing, sorry, online teaching, but it's not a standardized thing. The important thing is also student growth evaluations will be excluded from teacher evaluations. That was a big deal because you certainly don't want teachers to be held responsible for something that they have not been able to teach and complete a school year with their children, with their students. The TCAP scores will not be used in the final grades for the 2020 school year, which again is really important because our teachers and our students should not be held to a standard when they were not able to actually complete their education for the year. Every year, that's why if you have snow days, you'll have makeup days. Our students are required to attend 180 days of classroom instruction. That requirement has also been waived. The Tennessee Department of Education had to work with the federal government to get that type of waiver, specific also around our testing. High school graduation requirements are currently being evaluated. I know that a lot of school systems, particularly in Shelby County Schools has reached out directly to our students to see kind of what they're looking for as far as how they'll be able to graduate, what that experience will be. And certainly the state is working on those requirements to make sure they have everything that they need. So for more information though about the education changes that we've had, you can visit our new website that the Senate Democratic Caucus has put together, which is tncovid.com. So that's tncovid.com. Okay, I'd like to go to the next slide, please. So this has a list of different resources that K through 12 students can access online. We do have those on our website, tncovid.com, but it's pretty cool. Hippocampus, Khan Academy, Circle Time and Mystery Science. There are all sorts of entities that are coming together to give our kids online options when they are trying to make sure that they are staying on track and not having too much of an education loss during this time, okay? All right, so the Education Stabilization Fund, which is something that is a part of the CARES Act, the Coronavirus Aid, Relief, and Economic Security Act. It was signed into law on March the 27th and provides funding and flexibility for the state to respond to the COVID-19 emergency in K through 12 schools. All right, so to that end, it will include more than $30 billion for education, specifically $13.5 billion for K through 12. Part of the funding can be used to help districts transition to remote learning programs. So a lot of our districts, either if they're rural, a lot of times they don't have the electronic resources at home. They also do not have broadband or access to internet. If they're urban, you have some of the same concerns, a lack of equipment. Most people are accessing the internet on their cell phones, which some of these programs do not work with cell phones. So helping to provide support in that way. I know that several organizations like AT&T and Comcast have stepped up to actually provide free internet during this time for people who are of a certain income status. So districts will today be able to purchase laptops or iPads or something where they'll be able to actually access this education. The package also contains funding for colleges and universities. So many of them have been forced to close. I actually spoke to a representative from MTSU and they were talking about how this has significantly impacted their budget, because their budget was based on having attendees actually in the classroom, particularly looking at housing. So that's important. And this is another big thing, particularly for people in my generation and beyond. The bill puts federal student loan payments on hold through September 30th, 2020. I think that was really important for so many of us, because they, you know, when your income has been decreased because of COVID, the last thing you want to worry about is getting behind on your student loan payments, which can adversely affect your credit score. So that's pretty much what the Education Stabilization Fund, which is a part of the CARES Act, entails. Now I'm going to send it over to Senator Kyle.
Thank you, Senator Akbari. And of course, we're going to update you on any information that has to do with these slides. But I want to talk about the small business support as it stands today. Under the federal package, small businesses will have access to $350 billion in forgivable loans. Businesses can receive up to $10 million based on how much the company paid its employees between January the 1st and February the 29th. The loans will carry an interest rate up to 4%. The bill provides for very expedited origination process. That may change as far as the time that they're able to roll this out. If the businesses use the loans for the approved purposes and maintain the average size of its full-time workforce based on when it received the loan, the principal of the loan will be forgiven, meaning the company will only need to pay back the interest accrued. The small businesses, up to 500 employees, nonprofits, independent contractors, and the self-employed are eligible. This includes churches, but only to cover payroll costs of an associated business like a thrift store. As you know, this ongoing pandemic has a lot of clouds of uncertainty. So we will keep you updated, especially about our small business owners. And any more information that you need, you can visit the U.S. Chamber of Commerce website. As far as economic industry disaster loan, on March 18th, the governor announced that he had applied to the Economic Injury Disaster Loan Assistance from the U.S. Small Business Administration that would allow small business owners in the state to access up to $2 million at low interest rates. As of this past Friday, the state was approved. Now, small businesses, your nonprofit organizations that have suffered economic injury as a result of this beastly virus, they can apply for economic injury disaster loans up to $2 million per applicant to help meet financial obligations and operating expenses that would have otherwise been met. The interest rates for the loans are 3.75% for small businesses and 2.75% for nonprofit. The loans will be used to pay fixed debts, payroll, accounts payable, or other bills that can't be paid due to the disaster's impact. And for more information, call the Tennessee District Office. You see the number posted on our website. Thank you, Senator Akbari. I will kick it back to you.
Thank you, Senator Kyle. Alrighty, so let's see. Now I'm going to give you guys a bit more information about the CARES Act. That was the monumental piece of legislation that the federal government passed. So one, we have a lot of small businesses that have not been receiving an income for quite some time. So it provides $10,000 in immediate emergency funds to cover operating expenses. Additionally, they can provide loans up to $10 million per business to care for payroll, keeping our workers employed, paying rent, paying interest on any mortgage and any existing debt, and it could be forgiven if workers are employed through the end of June. That's the most important thing. It's called the Payroll Protection Act. A lot of small businesses have been applying for it. I know there have been significant challenges as well because the federal government released guidelines pretty much at the last minute. And so a lot of banks, particularly local banks, have been struggling to get on board. I know on Friday when everything was supposed to go live, Bank of America was the only bank that was live. But they're working through those issues, and this really is something that's truly very beneficial for small business owners. Relief will cover 6 months of payments, and this does not conflict. Like, they can also apply for other SBA loans. All businesses are eligible for a fully refundable tax credit for businesses of all sizes that are closed or distressed to help keep their workers on the payroll. The tax credit will cover 50% of the payroll on the first $10,000 of compensation, including health benefits for each employee. Employees with 100 or fewer full-time employees can use deduction even if the business is not closed. So for some of our essential businesses where they're not closed, but they're not making the same income, this will be a good resource for them. Okay, another thing that's really important, obviously, and that people are significantly struggling with is unemployment. And so I want to provide an update on how the CARES Act will help Tennesseans. One, the best way to apply for unemployment is to go to jobs4tn.gov. We've always been instructed calling the number really does slow down the process, trying to do something by mail. So if you can do jobs4tn.gov, that's really important. You can do it on your cell phone. You do not have to have a computer. The CARES Act will provide $600 per week for 4 months on top of the state's $275 per week maximum benefit. Once the Tennessee Department of Labor and Workforce determines how the state will obtain federal funding and implement changes, the department will announce details for independent contractors, self-employed, and business owners. So this is something that was really relevant today because Governor Lee indicated yesterday that he might not provide these benefits for independent contractors and small business owners. Now, fortunately, he committed today to saying that he would, and that he would go along with federal guidelines that have allowed for that. It's really important because you have so many people across the state who are self-employed and they are not making any income, and they deserve to have these type of resources as well. Now, if you are an individual applying for unemployment compensation, if your employer filed a claim on your behalf, do not file an individual claim. If you are uncertain if your employer did, call them to confirm. You are required to certify online each Sunday to notify the state that you are not working. But the good thing is, not good, because obviously this is a bad situation. We prefer if people stayed employed, but normally you have to be unemployed for 4 weeks and continue to certify every Sunday before you receive benefits. Under this new situation, after certifying once, you will start to receive benefits. If you want to check the status of your claim, go to jobs4tn.gov. Do not, again, you can call, but I think the most effective and efficient way is to actually go to the website. If you are locked out of your account on jobs4tn.gov, please make sure that you submit a ticket to lwdsupport.tn.gov. That's going to be really helpful to resolve things quickly. The state can provide your weekly benefit either through direct deposit or they will give you a debit card. You choose which method whenever you file your claim. Unemployment benefits are considered taxable income, so keep that in mind. You can choose to have your federal taxes deducted from your weekly payment. The maximum benefit, like I said earlier, is $275. And if you have any issues when you receive your debit card, you can contact Conduit at 855-462-5887. I know I'm going through this kind of quickly, but keep in mind our website, tncovid.com, has all of these resources as well. Our emergencies definitely has created a tremendous strain on our unemployment insurance system, but they're working as quickly as possible, and that's something that we've been pressuring our different government agencies to do because people need help now. So with that, again, visit our website, tncovid.com, for more information, but I'm going to kick it over to Senator Robinson.
Thank you, Senator Akbari. So the Tennessee Department of Human Services is on to help support families Through this pandemic, they've deployed $10 million in emergency grants to help childcare facilities. With loosened restrictions, providers can register with TDHS, who can provide them with support and guidelines. Now, on March 25th, Governor Bill Lee announced the emergency cash assistance seeking to provide families affected with COVID-19 with $500 to $1,000 a month. Emergency cash assistance applications are being accepted online for qualifying families that lost a job as a result of the pandemic state of emergency. You can apply online through the Department of Human Services website. If you want to check the status of your emergency cash assistance application, call 833-496-0661. Also, for childcare needs, this slide shows us the following guidance on childcare needs from the Tennessee Department of Human Services. And so it wants to, basically the premise of this is to allow other folks to be able to get approved to provide emergency childcare needs. So in the light of the emerging need for temporary childcare, DHS is providing guidance for families and organizations as they consider providing care for school-aged children. If you wish to provide emergency childcare to support your community's response to COVID-19, then you'll call this number, 800-462-8261, and you'll just select option 1. So how else can you help? If you have PPE to donate, I can tell you PPE or personal protective equipment, which is the stuff that we need in order to protect ourselves from contracting the virus. It's in a shortage in the hospitals and in healthcare organizations, even small facilities, home healthcare agencies that have to go out to see people. We need anything that you have, whether it's surgical or N95 masks. I had one of my constituents to contact me the other day. She's going to be a testing site and they're looking for PPE as well. If you have any of these items that are listed here, please donate them. That'll be masks, gloves, gowns, face shields, goggles, hand sanitizers, cleaning wipes, Tyvek suits, thermometers. The masks, they must be surgical or N95 masks. We're not looking for the cloth masks that are homemade. So if you have those commercial PPE products, please look to donate those. Senator Akbari?
All right. Y'all, we're heading towards the end of our presentation, but there's a couple more things we wanted to tell you about. One, in crisis, often you find interesting collaborations that can lead to really great innovations. As we're struggling to find the technology, one, to help workers who are out in the field, but two, to also fight the virus directly, it's important to have public and private partnerships. So to that end, Launch Tennessee has created a platform to allow folks in private industry to submit ideas so that they can help scale them up to be able to reach the market if it's something that can directly help during this crisis. You can visit our website for more information, but Launch Tennessee also has a website, www.launchtn.org/innovation platform. If you know any companies that are out there developing projects that might be able to help, please. And Memphis is in a unique position because we are a biomedical hub of sorts, and we have truly some great innovative companies. Connect them to that Launch Tennessee platform. And next, we've really been talking about this a lot. Small businesses are suffering. I represent District 29, which includes downtown, Beale Street, a lot of different restaurants and bars. I also represent Whitehaven, Millington, Central Gardens, parts of Cooper Young, and I think Cinder Kyle picks up Overton Square. Tons of small businesses, whether they're restaurants or their stores, you can support them still. Get your food ordered to go. Buy certain services in advance, like gift cards, or make appointments for future services, well into the future, of course. Make sure that you are looking at ways that you can support. A lot of us have friends who have small businesses. For people who are salaried and continuing to make an income, you are not necessarily, your economic situation has not changed, but a lot of our small businesses, the majority of them have. Shop online at small businesses. If you have birthdays or the Easter holiday is coming up, try and pick maybe a local restaurant that you can order dinner to go, or a local florist where you can get your Easter lilies. Stay looped in, make sure that you're keeping up with your memberships, and see if you can get services online from these small businesses. And lastly, just be a support. Like, we are in a time that we just could not have predicted or expected. And sometimes people just need a kind word. They need a lot of encouragement. And if you have ways where you can invest or donate to these small businesses, please do that as well. All right. So that concludes our formal presentation. I know people have sent in a ton of chat questions. We have our Senate Democratic Caucus staff online as well, and they can provide support as well. I've seen some of the questions. It looks like we have a wide range, and the good thing about that is we can contact whatever agency that we need to push your question or concern up beyond this discussion. So I guess we can kind of start with.
I would just like to add something as an update, if I may, Leader Akbari. Back on the Small Business Association, I just want to break this down a little bit. We have $350 million. Now, the banks are getting mixed signals from the federal government. Requirements are changing. We'll keep you updated. But to put it in context, last year, there was $50 million available, and it took a lot longer than a month to get that $50 million out to these needed businesses. So now we're talking about $350 million that was asked to be given out within a week. I just don't think that's going to happen. But we will certainly keep you updated. I know that those who have small businesses are very concerned as well. We all are. And I want to just ditto to Senator Akbari's remarks. Please go visit these local businesses online. Go by and pick up your dinners from these restaurants. We need to keep our community operating. These people who've been good to us, let's show them some gratitude.
All right, Senator Robinson, do you have any closing remarks you want to make as well?
I just want to encourage everyone to continue to stay at home. I know it's tough, but we have to ride this out so that we can flatten the curve and get back to some sense of normalcy across our community. But in light of that, I know there are some changes to your lives that you need some help with, and we're here to be able to answer any questions that you have or provide any resources, and even to take some input from you as to how we can be more impactful as we fight this pandemic.
All right. Thank you so much, Senator Robinson. Now we're going to go ahead and get to our questions. And of course, you don't have to chat your question. We will unmute your line once we go through some of the chatted questions, and we'll go from there. So let's see. First of all, thank you all for being on. I do appreciate that. We know that there are so many different things going on online, so we appreciate you being a part of our town hall. So I'm going to look at some of the questions. I think we're going to have one of our staff members read them, and then we'll kind of go from there. Yes, Malik, thank you so much.
Wonderful. So the first question I see over here has to do with testing and how we can make sure more people are tested. And I'll read the question in its entirety. The question is from Elena Devalga, and she said she's sitting next to Greg Blumenthal. She's concerned that testing, and there are a lot of people being tested at the moment. She says testing like people and those who are tested positive and can recover and go to work. So I think the question, and feel free to correct me, is basically what we can do to get more people tested.
I believe, since there are more private organizations, and I'm sorry, this is Senator Robinson, there are more private organizations that are producing tests. The tests are becoming more readily available to the community. One of the problems was early on, there was a lot of research going on as to how people recovered from coronavirus or if they recovered. And one of the requirements for that was that they be tested twice, at least 24 hours apart, to confirm recovery before they were cleared of it. And so there was a massive shortage of testing at first. Now we're seeing it rebound because we have other people who have entered the market with testing capabilities. But once we get past the peak of the epidemic, the number of new infections will decline while the number of recovered people will increase. And so as these trends continue, the risk of transmission will fall. But until we can get to where we're testing people to separate the healthy from the ill, we probably won't get there. We're still on the left side of the curve, meaning we're still climbing up. We haven't reached our peak. And that could be for a couple of months. But based on what other countries have gone through, it'll be months before the risk of transmission is low in the US across the country.
And I think if you look at, they're trying to increase the number of testing centers. We've been advocating that they are in more neighborhoods. I think that there were some concerns that some communities were being excluded, but again, you see a catastrophic failure on the federal level to ramp up the availability of tests in a timely fashion. Like Senator Robinson said, the private industry really has jumped in, even if you look at the amount of tests that are processed by the county or state health departments compared to the private labs. But again, I think that obviously you look at somewhere like South Korea where they did extensive testing and the positive results they've had. But we agree with you wholeheartedly and certainly have been raising that issue from day one, even before publicly this crisis really broke.
And that is one of the concerns of mine, because with the private testing, the patient has to pay for it. And we know the economic disparities that we face in Memphis. And the criterion for, the free testing is a little bit higher than it would be on the public side. And so that's another battle we have to fight as to how we can lower the criterion for free testing for people in Memphis.
Yeah, and I just want to say how proud I am of both Mayor Lee Harris and City Mayor Jim Strickland. I think that their teams have really gotten as far as we can get to tee up and be ready. And then for testing, medical treatment, there's more that we will be doing, but till we get a unified response from the federal government is how we should move forward. I think that both the county mayor's office and the city mayor's office have done an outstanding job for our community.
Wonderful. Thank you both senators, or thank you all three of the senators. We have a couple of questions, one coming specifically from Charlie, asking what we can do to stop the spread of COVID in state prisons and state facilities.
Well, I think, and I don't have all the details, but I know at least on a local level, it seems like there's some move to release low-level offenders. But it's something that we've been advocating for from the beginning, literally, before, when we were still even in legislative session, because if there is a outbreak in a prison, it could be catastrophic. So I know right now, if someone has symptoms, which again is not completely indicative of whether or not they have the virus, they are separating them and isolating them. But that's certainly a concern that we've been raising to the the Department of Corrections and to the governor's office through his COVID-19 task force. But I do know that they have a protocol that they've put in place. They're working closely with the Department of Health to try and isolate those that are incarcerated that might develop or test for COVID-19. Obviously, I think that any suggestions that you all have could certainly, we can push those up to the proper agencies. Sorry.
And I think it's easier to control on a local level because you have such low-level offenders. I know Judy Barrett was outlining her plan to get some of those out of jail, but on the prison side, I mean, we're almost at capacity. We're at like 94% in Tennessee with over 30,000 prisoners. So it's hard to contain, once it hits those doors, it's hard to contain the virus because the prisoners are in such close proximity to each other. I know Alabama has one of the most overcrowded prison systems, and they've seen an outbreak in one of their prisons and it went quickly. And so we need to be very vigilant about this. I'm not sure what the plan is on the Department of Corrections side, or if they have a protocol or plan in place to prevent the spread of the disease.
Thank you, Senator. Great question. There are several questions brought in by a couple of people that have to do with equity and how we can make for all public school kids to have access to educational resources while we're going through the pandemic.
You're breaking up, Malik. I'm sorry. Say it one more time.
Yeah, Malik, you're breaking up.
Sure, no problem. There are several questions having to do with equity and how we can make sure all public school kids in the state of Tennessee, regardless of where they are or where the school district is, have access to high quality education resources while we're going through this pandemic.
Well, I certainly think that those are sincere and real concerns, because if you look at kids who are at some private schools where they have additional resources, I mean, they're doing very structured online learning with the proper equipment. I know that that's something the department has been pushing, and certainly locally with SCS, they're trying to take advantage of cable channels. I think they have a couple of radio stations. They have teachers who are doing using the Facebook platform. They're really trying to meet the students where they are. The additional equipment that the federal government is providing funding for will go a long way as well. I know that there's some connection with, like I said, the private industry related to making sure people in certain communities have access to internet for free, which is a huge barrier. But again, that's something that we are very focused on and have been pushing the Department of Education, and they seem to be pretty forthcoming and interested in also making sure that kids, no matter where they live, are getting this high level of education. And that's because you have people in rural communities who live in deep, deep poverty, and they have some of the same issues that children who are in urban communities as far as access to technology. Now, I will tell you, from our perspective, as a caucus, we were not pleased with the additional money that was put in the budget, about $40 million for voucher funding to continue to ramp up that program. We've made that very clear. We do think that those resources could be used right now to help public school students and really all sectors, whether you're talking about education or other type of medical services that people need. So we're continuing to raise that alarm and to make sure that that kids are getting the type of equipment they need at home to be successful. The good thing is, though, that they will not be evaluated. So I think there will be a lot of catch-up work once the crisis is over, unfortunately. And I'm hoping that as we continue discussions with the department, we're making sure our teachers and our schools have the resources to actually do that.
I agree.
Wonderful. Thank you, Senators. We have another question about asset forfeiture, and if during the pandemic, people will have their cars repossessed and homes foreclosed on.
I think I lost him. Or did you hear it?
Malik, what did you say?
Sure, I'll repeat the question. There are a couple of questions having to do with asset forfeiture and if individuals during this time will have their property seized due to non-payment.
That's a good question. I think we need to check. I don't know if any of our staff members on the call have that answer, or any of our senators. I know that the Supreme Court has been issuing directives around this, but I don't have a direct answer on that right now. I know that they had to stop doing evictions during this time. Does anybody want to jump in with that answer?
From my understanding, the civil courts are not really hearing anything until May. So I don't think that you would be susceptible to that, because you can't. They can't hear the case for it. So I don't really have much information on it, but from what I've heard, they're not hearing those types of cases until May, and so you obviously would be, have a reprieve for that.
Mm-hmm. I think that's pretty much where we are. Okay, I see a question from Paula Payton about as a millennial, and she has peers who are non-healthcare but essential jobs have been deemed essential, and they are not having access to testing. Those in the healthcare field are getting more access to testing, and so how do we jump over those hurdles? Because because they're young, and if they don't have pre-existing conditions, it's very difficult for them to be tested. I'm with you 100% on that. One, a lot of them are not being given proper protection equipment. Like I saw my mailman, and I live in a condo building, so they have to interact with a lot of people, had no mask on. But when I went to Walgreens the other day, the clerk did. So I'm with you 100%. That's something that we will raise the flag and push that on up to our local and our state health departments, because it really is important. Young people, like they keep saying, well, people who are younger can spread the disease and not know they even have it. Testing goes a long way for that. So we definitely taking your concern, and we'll raise that up to the governor and to the state health department and the county health department.
There's an issue, a two-sided issue there too, because we have to have a way for people to report employers who are not protecting their workers. I know in New York State, they have 800 number you call if you want to report it to the state health department, and they will go investigate it and require that employer to put those protections in place. So that may be something we can explore, Senator Akbari. But the age group of 21 to 30 is the leading age group with COVID-19 diagnoses. So, I mean, you're making a great point, Paula, and it's not just, those who are out congregating. These people are contracting it at work, at school, wherever they are. But we have to do a better job of actually testing those individuals, and they have to be, knowledgeable about when they need to go get tested. Malik, are you there?
We are
Okay.
unmuting Senator Akbari again.
So also, I think another one of the questions, it looks like, has to do with, yes, we need to leave for, okay, bye. Bye guys, thanks for coming. Is it possible to make class set of books available to families, and then students can at least practice writing and reading? The textbooks are a bit antiquated, I agree, but it is a tool to keep students engaged. Parents are not used to directing education for their children, but if they have the tools on hand, I agree wholeheartedly. And I know that some schools, teachers are creating packets, learning packets for the parents to be able to utilize. That's definitely something that we can kick over to Shelby County Schools, because I know that, again, parents who are beginning to appreciate even more the critical role that our educators play in society, are struggling, and we want to make sure they have the resources they need. So we will definitely kick that all over to Shelby County Schools. Okay, and so also, I think Paula is saying that a Kroger employee told me they've been told they have to report to work regardless of potential symptoms. That is crazy. I do know that we've had several people email my office with concerns about violations related to symptoms and having to still work and not being kept safe. That's something that we are reporting directly to the governor's COVID task force, and they are responding. So that's something that we will do as well, Paula, and hopefully push for some sort of information line or something like Senator Robinson suggested, where we can directly connect our people, our workers, our community members, so that they can report if there's some sort of problem. Okay, so I think there's one more question that I think I did not see. How full are the local hospitals? That information, there is a study by the University of Washington that looked at the state of Tennessee. Let's see if I can pull it up so I can read it to you. But it focused on that Tennessee, while initially it looked like we were going to exceed the amount of beds that were required. Right now, they're suggesting that we will not have a bed shortage. They're saying, and that's based on people strictly following the social distancing orders. So we can get you that information specifically, but I know that they are reporting, the local health department is reporting that. I don't think that the state puts that out in their large report that they do, but we'll get that information for you. The last thing I think has to do with releasing information about demographics and subgroups that have been affected by COVID-19. If you all have been keeping up with national data in Chicago or Detroit or New Orleans or even New York, it seems that there's a disproportionate amount of people of color who are actually suffering from COVID-19 and are suffering fatalities. Our caucus has been advocating, and that's been led by Senator Brenda Gilmore, to the governor's office to make sure that they are releasing that information. I know locally Shelby County is working on it, and I think that that will hopefully, as we continue to advocate for, will be a part of our state data release as well. I think that will give us the more information on how to effectively target certain communities beyond the initial risk factors to make sure that people have the resources they need. So we're going to open it up to live questions, and then we're going to try and wrap up probably in the next 10 minutes because we have kept you all a little over an hour now.
Whoa.
I will do that. I'll reach out to her. I don't know how to call her either, but
I'll tell you.
tell her.
I'll tell you. Malik, mute our phones. Now, I'm sorry. So there is the ability to raise your hand in this chat somewhere so that we can acknowledge you. If we unmute everybody's phone, it's going to sound like World War II on here.
Exactly.
So you'll just raise your hand and Malik will unmute your phone. I do want to go back to that question from Charlie, Senator Akbari, about the hospital beds. One of the things that we're not tracking well is hospitalizations and ICU beds. I will say that New York is experiencing the issues that they have because they are number 220 in the number of ICU beds that they have per capita. Tennessee overall has a lot of hospital beds. However, our ICU beds, we are going to have a shortage. For instance, Methodist Hospital has over 1,600 beds, but less than 10% of those are ICU beds. If we look at the number of people that we have with a diagnosis for coronavirus, and we do the math on how many people are actually hospitalized, as we climb that curve, we're going to have a shortage of ICU beds. And so it's important that we put together some facilities. They were talking about using the Pipkin building. I know in New York, they've done the Javits Community Center. They're actually using a ship. They've got an old building that they've restored for ICUs. That's going to be very important because we're going to need vents and we're going to need people who can closely monitor these patients so that we don't send them back into the community not covered. So that is something that we need to address. I actually wanted to talk to you guys about it today, but I wanted to make sure that he had that information.
Perfect. I think that Jessica sent in a question on chat as well that has to do with absentee voting. There was a big push by the Democratic caucus to expand absentee voting. The majority caucus did not think that was a good idea. And you see in Wisconsin, people having to risk their lives to go vote, which is just insane, given the technology that we have nowadays. So if anybody wants to jump in on that, but I do know that our caucus has been taking that very seriously. And we've tried to legislatively get them to expand that. And they were not. So we're supposed to go back to June 1st. Allegedly, the legislature will resume. So we'll see. We'll certainly be pushing for that continually. So if you have a question, guys, please raise your hand. And we will certainly address that as quickly as we can. Oh, wait, I think Melanie sent in a question as well. Did I miss that one? Oh, yeah, okay, the statistics by race. Okay, got that. All right. Malik, can you see if anybody's raising their hand?
Paula is raising her hand. I'm about to unmute her right now.
Perfect.
Hi, everybody. Thank you guys so much, first off, for doing this today. It's really helpful. My next question is, I'm kind of wondering, I've been reading a lot of reports about the rates of child abuse. Obviously, we know things like child abuse, domestic violence, all of that tends to skyrocket the more that people are forced to be at home, right? I mean, that's just a, natural thing that follows, when you have abusive people and children and victims just being stuck at home with them more often. But I was wondering specifically about child abuse, like if we've seen any statistics yet of what those numbers are looking like in Shelby County. Have we seen, an official increase? And are there any solid plans laid out yet about how to combat that or what to do in this specific situation? Because I know it's also more difficult for caseworkers to make home visits and things like that, because, you can't make a home visit and check on people and stay at your own house. So just kind of wondering about those things.
Okay, well, I do know that our social workers are, and some of our DCS workers are deemed essential. But definitely there is a concern for an increase in abuse all around, domestic abuse, given that people are in close proximity with each other and there are few resources and outlets. What we will do is kick that concern up to the Department of Children's Services to make sure that that is something that they are prioritizing, and we will get that information certainly back to you. We're working on legislation right now that has to do with that, and will kind of help once we return in June, that will help with what's going on and make sure that there's a different type of reporting system in place, something that we can utilize technology like we're utilizing right now. But certainly that is a huge concern for us. We want to make sure that our children, our elderly, and those who are in domestic violence situations are still being protected and cared for.
Right. And I kind of also wonder, you were talking about, throwing out ideas just as you're looking at this stuff, maybe, I know teachers know children best, right? Outside of their families, that's who knows them the best. So, maybe a teacher doesn't know, enough where in a normal situation they would report, but maybe an idea could just be like, almost like a list of like, these kids may need a little extra check-in or something like that. I don't know. I mean, obviously there's a lot that goes into that, and you want to protect people's privacy and all of that. So there's a lot of thought to be done there, but maybe just if there's a way where, you almost just have like a backup for those particular children, because the teachers would be a great resource there too.
Right.
Thank you so much for that, Paula. And actually, I'm communicating with one of my staff members now, and he just mentioned that, it reminded me that that type of connection is in the legislation that our caucus is pushing. Related to checking in. So yes, thank you for that awesome idea, and we are right on it.
Thank you.
All right, do we have any additional questions?
I'm not seeing any hands raised just yet.
Okay, all right, well guys, listen, I know that we've kept you, it's been a little over an hour. I want you all to know this. One, we are a resource for you. If it's not something that can be handled on the state level, we will connect you with the proper city or county individuals. Certainly, there are lots of mixed messages coming from our federal government and even from our statewide government, but we can help you get through and cut through some of the red tape you might have on questions or concerns. We can connect you directly to your member of Congress, so please feel free to reach out to us at any time. We're going to continue to do these types of virtual town halls, either as a Shelby caucus or individually, and connect you to the appropriate commissioners and those who are working directly on this type of policy. Our website, which has been created by our Senate Democratic Caucus staff, is phenomenal. www.covid19.com. It has all resources related to education, healthcare, unemployment, all of those things. So please reach out to us on that. Please give our Senate Democratic Caucus a call, and we have our contact information on the website if you have any questions or concerns. I'm going to kick it over to Senator Kyle and then Senator Robinson if they have any closing remarks they'd like to make.
Okay, thank you, and thank each of you all who have attended today. I just want to remind you that the Tennessee legislature is only on recess. We are supposed to go back in to session in June. Of course, that may change, but should we go back in, the Democratic caucus will be addressing again voting by mail and some of these other criminal justice reforms, like if your only charge has been marijuana, should you really be in jail? We don't think so. So we'll be addressing that, and of course the educational needs. But if there's any other concerns, know that we are to go back in June. We have not adjourned. And any other issue you want us to bring up, we will. We have good relationships. The state does with both the city and county. They do an excellent job for our community up on Capitol Hill, and we'll be working with them again on all the matters we have talked about today. And we will be updating our website to more relevant information as it comes out. But thank you so much, and I appreciate your time that you give to us. Senator Robinson.
Oh, I'm sorry. I just wanted to make sure that I express my sincere gratitude to everyone who is on this call. I know this is a time where, you know, everything is up in the air, and if you're like me, you don't really deal well with uncertainty. And so this call, I'm glad that we were able to put this on for you guys. Hopefully we've been able to answer your pressing questions, but if there is something that comes up or that we have not addressed, please make sure to reach out to us. We're also, this is a two-way thing. We're dependent on the community to be able to give us input and feedback as to make this go better for you guys. I mean, we're navigating some waters that no one has ever tread before. And so it's going to take a community to do that. We can't just get there with, you know, us on the other side. We need to see what's going on with you guys on a day-to-day basis. And so if there's anything that we can do or anything that comes to mind or issues that we haven't addressed, because I'm sure we haven't thought of everything that's going to be an implication of this coronavirus, please reach out to us. Thank you so much.
Thank you, Senator Robinson. And I just want to reiterate, if there are some questions in the chat that were not answered, a member of our Senate Democratic Caucus staff will reach out to you. If you have any questions or concerns, please call 615-741-1767 or visit tncovid.com. You would be surprised what sort of issues will come up and how quickly we can help get them resolved. I also just want to thank our staff who have been great for putting this presentation on. Thank you guys so much. And listen, hang in there, stay home, stay safe, stay healthy, stay sane. This is a time that brings out the best in people. And I think that if we just work together, stick together, but stay apart, we can help flatten the curve in Tennessee. I know that our numbers, we've been told, are going to get worse before they get better. So just be encouraged, try and be as much help as you can for others, support our small businesses, and of course, stay informed on what you can do to help flatten the curve. All right, y'all, you have a great evening. Thank you so much for joining us. We'll continue to update TennesseeCovid.com with additional information, and certainly this will not be the last time that we get together for this town hall meeting. Y'all have a blessed evening.
Thank you.